All right. Well, obviously that's supposed to be funny, but there is sort of that sensation when you give birth in a hospital that they'll soon have you cured, right? Like there's oftentimes a medicalization of childbirth when you deliver at a hospital. So there are different options now of where to deliver a baby. There are birthing centers that have sprung up, really a lot more since the late 1970s, to have more birthing centers. They're sort of freestanding. Sometimes they'll be connected to a hospital, but the idea here is that, we're going to treat labor and delivery like, a natural thing, and that for the vast majority of women, they don't need medical assistance to deliver a baby. And birthing centers were the ones who started to innovate, having fathers present, or other people present at the birth, and to make the setting much more home-like, and a bunch of things that birthing centers brought into the picture that now a lot of hospitals have started to incorporate. They, like almost all hospitals, allow dads to be present, maybe not during an emergency cesarean or something like that, but generally dads can be present during deliveries in hospitals thanks to the innovations that birthing centers brought. And then there are home births. And this is a very small segment of the population that has babies at home. Usually it's going to be with a nurse midwife or a midwife. And one of the first things people worry about is that it's going to make a mess in the house. Like people are very worried that the childbirthing process is very messy. But there are all sorts of, absorbent, disposable things that can be placed around, in the birthing area that prevent the mess. And so now what we're left with is concerns about safety. And one advantage the birthing centers have is their close proximity to a hospital if something does go wrong. When you're at a home birth, you're really, it's a function of how far you live from medical specialties and stuff. And sometimes things do happen in deliveries that would require transferal to an emergency room or to the hospital. And so it's a little bit of a risk to have that extra delay between recognizing that something's going wrong and needing to be transported to the hospital. So that oftentimes causes people to think twice about a home birth. But they are becoming much more common, and a lot of people who deliver their babies at home report that it's, very peaceful. If they have older children, a lot of times they say they like that it didn't disrupt them. We didn't have to wake everybody up or get grandma and grandpa to come over to babysit, or these kinds of things. Like you just have the baby at home. The older children are, some families will have them present at the birth. Some just have them in the household and not having their routines messed up. And so there's different factors that go into people deciding this. Are you going to use pain medication or not? There are two main classes of pain medication. There are the narcotics, which are usually administered early in labor, and they're usually designed to basically make it so that you just don't care as much that you're in pain. Like you can relax now because you're not so tense and upset about the fact that you're experiencing pain. And then there are the epidurals, which are medications that are injected around the spinal column so that the area in the pelvis will be literally numb, so you just don't have to feel it. And again, for a lot of people, the epidural will relax them enough that now they are no longer tensing up and they can actually progress with their delivery. For other people, epidurals can slow delivery. So it's really a individualized kind of effect, whether, for some people, narcotics make them throw up. I know for me, I would rather have an unmedicated childbirth than throw up, so I wasn't willing to try the narcotics. Some people are nervous about epidurals potentially leaving them with numbness or tingling for the rest of their lives or something. And really, honestly, that's not even on the list of risks for most people. It's not something that's likely to happen. I was paranoid about it, so I was willing to have a baby unmedicated rather than risk that. And then by the time I decided, oh no, this is really actually starting to hurt, can I get my epidural? They said I was too far along and it was not going to take time. It wouldn't take effect before the baby was born. So I waited too long on that. But, different people have sort of different attitudes about it. And one of the things I wanted to share with you is that, in the 1980s, it became really common to tell women that, a good, healthy birth wouldn't include, especially narcotics, but an epidural either. The narcotics argument was that it would actually pass through the placenta and dope up the baby, and that this would somehow be harmful to the baby to be exposed to these narcotics. I think I made a pretty good case back when we were talking about teratogens that by the time the baby's ready to be born, these narcotics are probably not going to have any kind of like big effects on the baby that would like harm them. But some people worry about that the baby will be too sleepy when it's born or not want to start feeding immediately or other kinds of things. So some people worried about it like that. But other people talked about it like, if you want to be a good mom, you should be able to do this very natural thing, and you shouldn't expose your baby to anything, that women throughout history have given birth without pain medication, and you should be able to do it. And in case you think I'm overselling that judgment component, I wanted to share with you this little clip from Look Who's Talking, where she's in labor, and look at how the nurse who's reading Enquirer magazine reacts to the mom's request for drugs to help her through the delivery. I'll see you on the other side.